again, everybody. Welcome. Hopefully everybody's safe and their families are safe. For those of you who don't know me, I'm Steve Romig. I'm the host of the DIGFM meeting here in Santa Clara, with quotes around Santa Clara right now since we're all over the place. I don't really have much in the way of an opening presentation here. I'm really just going to turn it over to Julie and Maka and Chris, who are going to speak about what we're doing or some of the things that are going on around all the COVID stuff and FileMaker. So, and then at the end, sure, we'll have time for questions and anything else. So with that, I'm gonna kick it off and turn it over to whoever's speaking first.
Couple announcements though. Does Claris have something to present next month, I think?
We could talk about that at the end.
Okay.
Perhaps we will.
And then anything about, was it Claris Engage?
Do we have anything to speak about Claris Engage that you guys don't already know? I'm not sure.
Well, I think just yesterday I found out that it was called Claris Engage and not DevCon.
Just yesterday, Eric?
Behind.
Exactly.
Yeah.
So there you go. So you have plenty to tell me.
That's the least exciting news about Claris Engage.
So it's going to be all online.
Yes.
Okay.
And we will be sharing more when we know more. But yes, it is. We are going virtual this year. We're going to see how that goes. Working hard to get ready for all that.
And then I think in July, I had trouble reaching him again, but Louis, I think, was going to present in July about what was it called? But it's not Ruby. It's he's got a like a GUI way to program a lot of the stuff for the APIs. But yeah, he'll be presenting that, I think, in July. I'll have to get a hold of him again.
Sounds good.
All right. Well, then it's back to Julie.
All right.
Want me to share my screen, Julie?
Yeah, would you do that? That'd be great. Well, this is like such a treat to be able to come in and chat with you guys. And I've been really, really looking forward to this. I think Maka and Chris and the team have as well. So thank you very much for inviting us. It's really quite an honor to be chatting with you. So all I was going to do was sort of kick off what we have been doing related to the Claris COVID response, and then I'm going to turn it over to my fellow CCRT participants, and they're going to talk about some of the solutions that we've actually been working on and deploying. So my part is probably the easiest part and maybe the most fun. So, you know, with Brad on this call, when we saw and when Brad saw the pandemic really escalating in March, he made a request for us to see what we could do to be able to respond to that in a way that would be meaningful and helpful to customers that could maybe use our tools and leverage not only the products that we have, but also the wonderful ecosystem of professional developers and partners that we have. And literally within a weekend, we were able to compose a core group of a team that we spun up very quickly. I use this analogy: we've been building the plane while we've been flying it, and I think a lot of us have been doing that in various ways during the pandemic, and by no means is this any different. But we spun up a group of smart people and built a charter and a set of initiatives of what we wanted to accomplish, and then started getting the word out via the blog and communicating with partners. And we have been having some great success in being able to help a lot of people. The team members that are on the Claris COVID Response Team are on the slide before you. It is a cross-section between Claris, the Join Table team with Chris and Maka and Jonathan Nicoletti and Molly Connolly. And then as we've evolved, we've added more skills and more resources just to manage this team because the incoming is unknown. And so to balance the level of need and to be able to be responsive, we added Jordan Watson and Mark Richmond. Jordan Watson is a partner in the UK in Europe, and Mark Richmond, Skeleton Key. I'm sure most of you know Mark. I don't think he's on the call, but know him. And he is a platinum member and also part of the partner council, as is Jordan. So we were able to leverage the team and start to embark. So I'll spend just a second and talk about what the CCRT mission is and what our criteria was, and then I'll try to get out of the way and let the group kind of talk about what we're doing or what we've actually accomplished to date. So our intention was very simple. It was to be able to combine both the talents that we have in our ecosystem along with the software that Claris offers via an extension of our trial, bring those together and be able to offer at no cost solutions that are directly able to mitigate and help something related to the pandemic. We scoped that to healthcare, education, those that are in disaster response and nonprofits. The intention is that there would be a sponsor, so it's not just I think the app would probably be useful. It's an intention that there is an end user organization identified at least at the beginning of the project. We're looking for high availability, high impact, and things that are reusable. And we took off with this with the idea that we wanted to get the word out so that we could get those that had needs coming in to the Claris COVID Response Team. Then we would decide if the project was a fit. Then we would put a team together and we'd be off and running. And that's kind of what the initial thought of the intent was. What also ended up happening is we had so many of our developers that came to us and said, you know what, I have probably a piece of code or I have an app that I think could be reused, or I've created something for this customer that asked for it, but I bet you it could be reused elsewhere. Here it is. If anybody can use it. I mean, the outpouring of generosity was quite astounding and quite amazing, and absolutely, when I think about it, it just touches my heart. The giving that occurred and still occurs on a daily basis throughout this community and this ecosystem. And so we actually then had to build sort of a way to bring in the solutions that were coming into us, or pieces of the puzzle, if you will, and vet them and get them ready so that we could reuse them. I don't even think we anticipated that on day one, and we kind of went, whoa, we gotta attack this from a couple of different angles. And the joint table team and has been amazing. The developers that they've reached out to have been so extremely responsive. The asks have been from here to here of every kind and flavor, with needs that are some so very urgent and some innovations that don't even exist yet that are being invented. It's truly an honor to even be a small part of this and to continue to see what we can do to help during whatever the length of this pandemic is. And I'm very grateful to work for a company that was able to have the latitude and the forethought to put this together and be able to make something that I think is helping and sustaining as we move forward. So I think with that, I'll turn it over to Maka and Chris to talk about our intake process and then some of the solutions that we've done.
Okay, cool. So when we get requests, so we do have a guideline. So basically we usually meet and we decide, okay, are we going to take this project on or not? And this is really what we're looking for. We're looking for projects that are in healthcare, education, government, nonprofit. You know, it has to be COVID related, and it has to be immediate high impact on health comfort of the infected or education, and impact on reducing, you know, short-term or cumulative of infections. Can be created and deployed on a somewhat compact timeline. So we're looking things that we can have an immediate effect, and ideally they can be leveraged by several providers. And also a lot of our a lot of the requests that come in are from for-profit organizations. So normally Join Table, we only work with nonprofit organizations, but we have kind of nixed that requirement out. You can be a for-profit organization as long as what we are volunteering our time for is not for profit. So that app itself is not going to be, charged. There's no charge for other people to use it. It'll be distributed freely during the pandemic. So we'll talk a little bit about our, well, maybe we should step back and maybe Chris, you want to talk about what is Join Table? I'm not sure if everyone here knows what Join Table is. So maybe we can step back and kind of say what it is and what it's about. You want to talk about that?
Yeah. So, hi. Join Table started, I think, maybe a year and a couple months ago. So it was just originally me, Maka, and Jonathan that we had kind of all met through some mutual contacts, Molly Connolly being one of them. And we kind of just had this mutual interest in sort of giving back to the community. So basically, Join Table is a sort of a matchmaking organization that is made up of these 3 veteran FileMaker developers, and we have intake forms that you can see on our website here at jointable.org/contact if you go there for volunteer developers and or documenters and or project managers who want to kind of donate their time to build or work on apps for at least pre-COVID in apps in nonprofit and public schools, with organizations that have a need for an app, mostly obviously nonprofits. So nonprofits fill out a form, volunteers fill out a form, and all of that data goes into, surprise, a FileMaker database using Claris Connect. And then we kind of just match developers and teams up with these projects based on language compatibility or time zones or skill matches. And when the volunteers fill out a form, they can sort of indicate, these are the types of projects I'd be interested in. These are the types of projects I have experience with, and the parts of the Claris ecosystem that I have experience with, whether I'm a senior person or want to work with a senior person or whatever. So we were kind of already doing that. And then when the COVID, pandemic happened, we just were able to kind of leverage what we were already doing and that some of that workflow into this greater cause of the Claris COVID response team. And what you can see here is a cool little JavaScript map that Jonathan made showing all of the live volunteered hours per month worldwide across all the different countries. So right now we technically have the capacity for almost 6,000 hours a month of donated time. So that's just absolutely, completely extraordinary.
Yes. I will say also, Chris, you mentioned, we had been essentially an organization for about a year before Brad reached out to us. And once we kind of made public that we were doing this, our volunteer base doubled within 24 hours. It was the outreach, the people who wanted to help. People were just really, it was amazing to see. Like we get emails with every volunteer, and it was like email after email after email of people wanting to help. So
it seemed like it was 24/7 for a few weeks there, that all through the night, all through the day, things would come in. So that was just amazing.
Awesome. Yeah, and sometimes I've gotten people like sign up twice, and because they like really want to help. And then I've also gotten emails from people saying like, when can I start, or when's the next project, or people are very eager to help. So it's really awesome to see that from the community. And I think everyone that we've and we'll talk about some projects in a minute, but everyone has been let's do it, let's start. Like before we even finish the details, they're like, yes, I'm in. So it's really cool.
Yep. So if you want to be one of those volunteers, or if you know of an organization in your area that would benefit from an app like this, then go to that page and sign up, or there's our email address. And that goes to the whole team. You want to go to the next slide?
Yep. Oh, one thing I'll mention. So this screenshot here is from a documentation training that we had. So we did also make a call out for documenters. So we'll talk about the different apps we made in our repository. But I think one kind of the unsung hero of making an app packageable is creating really great documentation for it.
Yeah.
So that's another area that you don't have to be extremely technical to volunteer.
that team is led by the way, by Susan Prosser, who I'm sure a lot of you know from going back in the community, but as well writing the famous FileMaker Missing Manual series with Stuart Griffin.
And David Head is helping with that too.
Yeah, David Head is helping with documentation too. It's pretty amazing. So this is the I love this slide. This is just the free trial licenses. Julie, do you want to talk about this?
Sure. Thanks for the embarrassing clip there.
I mean, we prevented
You
these.
approved it.
This is all the work and home gear we're all wearing.
I
Don't
love this picture too. It's so perfect.
worry.
I think as like Chris was saying, I mean, at the very beginning of this, I think we were almost 24/7 for several weeks straight. Any hour of the day, didn't matter if it was Saturday, Sunday, it was just all hands on deck. And we had very frequent meetings to try to make sure that we weren't clogging anything in the system. It was really important to us that we kept things flowing through. And so I think after a while, it was on that day, I decided that I needed to have a crown. So I put one on. And
You need one every day.
And for those of you that are Apple fanatics, that is truly a vintage Apple sweatshirt that I probably shouldn't wear, but it's really comfortable and I do wear it and it just makes me feel good. So that was my get up for the day. The extension or what we're providing, just for clarity in terms of software, is we'll really provide any FileMaker software and we'll do an extension of our trial. So it doesn't matter if it's concurrent connections, it doesn't matter if it's on-prem, it can be in FileMaker Cloud. If it cannot be in FileMaker Cloud and needs to be hosted elsewhere, I will state that SMP Host so graciously said that they can, at no charge, provide some hosting along with us if needed. And so that has been phenomenal for them to even offer that. Again, what we're trying to do is provide these licenses during the critical part of this pandemic. And when we began this, that's through the end of the summer, we may need to extend that. So we're trying to just, while everybody's really trying to get things organized, getting things thrown at them that they had no idea that was coming to them, and they have to solve problems in critical situations, we didn't want buying software to be part of the discussion. And so Brad authorized us to be able to give extensions of our trials to any of these cases that we were working on, and that has been great. And what we've provided has been all over the board, from big and small, just depending on what the need is, and it's been great. I do want to mention too that there is no obligation for any person that does a project from Claris that they have to buy anything. So they have an extension of the trial. If when the trial is done and that winds down, they don't have to buy anything or do anything after that at all from us. So there is no obligation at all after that.
Yeah, so one other thing we talked about was building and sharing a repository of your reusable apps. And so this is a screenshot from our FileMaker app where we keep track of our repository. And so you can see this list is pretty big and it's growing. And the idea is, a lot of these apps are donated, directly from a partner or an organization, but also, as we've actually built these apps, through our volunteer base, we'd like to eventually put them in the repository as well. So I know this is probably really hard to see, but one example here is COVID Clean. So this is one that 360works was, Molly kind of organized it, but 360works was the volunteer for it. And what it does is it is for helping, it's essentially like a checklist for cleaning apartments. So as a janitor goes from apartment to apartment, they have a little checklist and make sure that they are cleaning up to COVID standards from one apartment to the other. So that is obviously something that I think that any apartment complex could use, or hotel or anything like that. So that's why we're keeping track of this repository. And you may have seen through the Claris blog post, you know, as they get like pretty close to done or close to done, and they have documentation and they're pretty packageable, we'll start posting them on the Claris blog, so that way people know that they exist. Because I think a lot of these you may not know you need it until you know that it exists.
I think the repository too is one of these little sort of magical bits of serendipity that came about when we all kind of put our heads together to form this little group. Is we were trying to match volunteers with building custom apps, but as we were talking to developers and nonprofits, they were like, I want to do something, I want to volunteer, but I have this app and it's very relevant, or I have this inventory thing that you could deploy in a second to do this. And so we got a lot of these from people just being like, I have this, I want to give. So we were like, okay, well, we're gonna start collecting these and organizing them and documenting them and sort of like spinning them back out into the community, so we don't need to keep reinventing all these wheels all the time. But I thought that was pretty magical myself.
Agreed. All right, so we'll jump into the very first project. So I think this was our kind of our pilot in a way, and it's still ongoing. And essentially, well, Julie, do you want to talk about this one, or Brad maybe? Because I know you were the one who brought this to the table.
Sure. No, I'm happy to. So this is a solution that came to Brad from a company that's in the Netherlands, I believe, or Belgium. And this Sigfrinius is an organization that has a FileMaker solution in place, and they work in the hospital industry that puts IDs or you know, through IoT, it will manage equipment within hospitals. So where is the respirator? Where is this machine? Where is that machine? It manages the inventory as that inventory moves around the hospital. And that is an existing solution that they have. When the pandemic came, they started thinking, you know, maybe what we could do is take a device, a wearable device, and in early conversations, it was even thinking about doing an Apple Watch. We've gone through several iterations, but essentially taking a device that can monitor, and I think there's 12 or 13 different monitoring components, but like heart rate and blood oxygen level and temperature and those types of things, and be able to capture that through Bluetooth, then push that to, in this case, a FileMaker system from a patient. And I believe the spec right now is every 3 seconds around the clock, alleviating the necessity for a healthcare worker to have to go and take every one of the monitoring checkpoints for every single patient, and also taking more monitoring from every single patient than a healthcare staff could do. So the intention there is to, you know, again, this was project number 1, started in March, very lofty, you know, tough things to climb when you have a wearable that has to be created, which they are through a manufacturer. But to be able to come up with this kind of technology, and it's going to be very innovative. It's weeks away from deployment. Like I said, the hardest part is the wearable device, but it's been really fascinating to watch. And I can tell you that the leadership at Sigfrinius, they just don't give up. They are relentless on making sure that they are going to find a way to get to their solution. They are so committed to this. And so we're absolutely delighted to be a part of it. This is a combination, by the way, also of a FileMaker deployment as well as a very unique connected deployment in order to be able to do this. And so we're super excited to be involved and can't wait for this to deploy. It's going to be very innovative.
All right, so the other one we have here is Percentric, and the app is called Percy MD. And this one, Barbara, why am I forgetting her? Barbara Conley? No, Coonley, I think her last name is, from Geist Interactive, took this one on, and I met with Todd to kind of walk him through everything, and she wanted me to get the care from him. And I was just amazed. Just this meeting with Todd, he not only said yes, we'll do it. He's like, we'll give you servers. We'll give you. He's like, we'll give you whatever you need. We'll host up. He said something like, we'll host up to however many servers you need, up to $500 a month out of guys' expenses. And I was like just blown away by their generosity. But so what this app is it's a texting app so that doctors can text patients instead of having a patient come in. So it's similar to telehealth, right? Like when you do the video conference, but instead of, a 30-second video conference, you have access to a doctor over several days or as long as you need. And it's really effective because, you have that follow-up over multiple days. And so it's really great to be able to track the patients, see how they're going. And the idea is really to just prevent people from coming to hospitals, have access to a doctor from your phone, and not have to potentially expose yourself or expose other people by going into urgent care or whatever for an issue. And it's really cool that he has I can't remember he's using several different external tools to do the texting, and I can't remember exactly what they're
There's a there's like a web API gateway, and I think some of Andrew Duncan's FileMaker SMS technology might be in here too.
Yeah, he tested it out on Chris and I, and it was really cool. It was everything he was able to do. He has some templates down here, so you can see that he does basically like auto reply. And he said something really interesting when we met with the doctor. His name was Dr. Brian Fine, and we met with Dr. Fine, and he said, I've tried different methods to try this texting, or this he said even if I text a link, people don't click it, they're scared. So he finds that just pure texting is the safest way to kind of get people's buy-in right away. And especially like the older community, it's hard for them. They don't, email sometimes is difficult, clicking on links and filling out a form is sometimes difficult. And for most people in that community, texting is just the most straightforward and effective way to reach as many people as possible. So this has been enhanced by Guy's team. They really, made it better, and they're hosting it now. And I believe it's gone to several. So he's actually located in Virginia, Dr. Fine, and I think there's now several doctors in California using it, and they're just keep expanding on who's using it. And this will be on the next blog post as well. Julie and Chris, you want to add anything about this one?
I mean, I just think that the simplicity for the user on this one is just amazing. Just imagine it's just their phone they already have, right? It's their iPhone, it's their Android phone. They're just texting a doctor, and then on the back end, there's this exploded full database of every time they text in, they can click on them, they can sort them, they can look at the entire history of the conversation. They can, like Maka said, there's lots of little shortcuts that they can, so that they say the same kind of advice or medicine or whatever consistently and all that kind of stuff. They can search it, they can filter it, they can look across patients for trends kind of on their own back end to understand what's going on. I just think it's kind of a really neat way to do care that I had not heard of before.
And he also had, like, on the right hand side, there must be different options here, but the one that we saw was like the entire medical history of the patient. So and he had like check boxes for COVID related symptoms there. So
and like links, he could share like a whole library of links he could share out. Like if you're thinking you have something, here's a link to an article you can read that can help you stay hydrated or whatever. So they don't need to kind of go over that. They have a whole bunch of stuff they can just link out to triage it and make it fast. Templates, I think at the bottom left there's something that's under the templates.
Right. Yep. Templates.
A fun fact about this one too is the way that we found Dr. Fine was he put a post to Brad in the community, and that's how that started. And when I spoke to him, I thought it was what touched me the most is he said, there's a lot of elderly that don't understand how to do a FaceTime. They don't know how to, use Zoom or download any telehealth software and try to get that up and running because they're not techy enough. He says this is a low bar to access medical help. If you know how to text, you can get medical help, and then we can keep the elderly at home where possible and not have them leave their home when they don't need to. And I was sold. I mean, that's all he needed to say as far as I was concerned. Like, let's go.
And on their end, it still works on a 1998 Razor flip phone, right? Like it's just kind of cool. All right.
Another thing that's a little bit interesting about this one too is, this is Dr. Fine's life right now. So he is totally happy with giving this away for free during the pandemic, but he obviously needs to make a living at some point. So this is one of those, we talked a little bit earlier about, it's okay for you, if you're a for-profit, we'll still help you as long as it's free during the pandemic. So this is a great example of that. So he would love to get this eventually into like maybe hospitals or even big organizations that just want a doctor access on staff. But for now, for pandemic related reasons, this will be free. All right, so the next one is the dentist emergency app. And this one is located in Paris. And this is the dentist here, Dr. Boris. And this was an interesting example because Dr. Boris is not a FileMaker developer, but he built this app by himself. And he actually, in my opinion, did a really amazing job for not knowing FileMaker. And what it really is a triage app. So, dentist offices are closed. And they need a way when there is a request to evaluate that request and see, who is this a true emergency? Can this wait? Yes or no? If it can't, who can take it? Who can I assign it to? So that's essentially what this app does. And what's interesting is it's all in French. So we needed someone from France to help us, or someone who spoke French, and we didn't have any volunteers from France. So luckily we had a ton of volunteers from Canada. So I was like, okay, who sounds French in our list? And from Canada, and we were able to work with Alan from Vehicle Media, and he was just amazing. He spent, do you remember what that number is? It's in the notes. How many hours?
Well, I don't know. I can look it up.
Over 200.
Yeah, it's like, I think it's 250 hours helping him kind of enhance this app and do all these features and integrate it. And I think it was originally integrated with Google Docs, and then he made it, much better and integrated with the website. So it was just a really good project. And again, this one has grown and it has been expanded to multiple dentist associations in Paris. So it's not just Dr. Boris using it; it's multiple different associations in France. Pretty cool. Any other thoughts or feedback on these two? Or sorry, on this one from you two? No? Okay. All right, so this one is a PPE inventory app for a city in the United States. And this paper right here is what they were using before FileMaker. So it's literally just a piece of paper. And so this city needed to track all the PPE that was coming in, and they actually took a stadium that they were using. I think it was the basketball stadium.
It was a giant, one of the biggest indoor stadiums in the country. Yeah.
Yeah, it was a basketball stadium, and they converted it into a PPE warehouse. And so they had these piles of different sources. They wanted to keep all their PPE tracked by source. And so they had this big Google Docs sheet where they were tracking everything. And if someone came in, so their example was like a funeral home came to them and said, okay, I need, 5 masks, or I don't know, 10 masks and 20 gowns or whatever they said they need. They would have to come write this down on a piece of paper. They would go to that pile, get that equipment or get that PPE given to them, and then drop off that piece of paper to someone sitting at the computer. It was a volunteer firefighter sitting at the computer, and then would have to update the spreadsheet. And their main problem with the spreadsheet, obviously, it wasn't that easy to use, but it was really hard to report on it. Like they were just having a really hard time, like actually getting burn rates and by source, and being able to make projections on what they need and what are they low on. So so we had some volunteers from Slide Consulting, and so they took on this project. Team Graham was Josie Graham and Graham. Why am I forgetting his last name? Another guy. His first name is Graham, and he they built this app together, and it's really nice, and also it's mobile. So this is a WebDirect interface for them to actually instead of using this, they're able to just from their phones, any phone, they can enter what they would like, and now they have charting, and they're able to analyze this data and do burn down rates and all that. So
Graham Young, right? Graham
yes,
Young.
thank you. Sorry, Graham, if you're listening. I feel bad. Graham Young, thank you. Yeah, so that is this one, and this is another one that I think has a lot of can be repurposed in almost any city, right? Might need to use this, so definitely a good one to be able to repurpose. In fact, actually, we have a project in India who is using who got a copy of this app and is now using it. They're repurposing it, they're tweaking it for their needs, and then. All right, this one is you, Chris.
Yes. So this one is actually, I don't want to put you guys on the spot, but I noticed that Jay and Fabio are here in the meeting, and you guys are the ones that are building this, and I don't want to take any thunder from you of any kind. You guys are knocking it out of the park and killing it. Do you guys want to talk about the solution that you came up with for this one, or do you want to be shy and have me do it? Jay, you're on mute. Jay, you have to go off mute first, I think.
Is this his way of being shy?
Yeah, there's a little mic button at the bottom, I think.
Steve might be able to unmute him.
Oh. Well, I can start. So basically, oh, he's off mute now. Jay? Go ahead, say something. Does anybody hear Jay?
No.
Okay.
No. I did unmute him, but.
Oh.
You could try Fabio. Fabio is also the author on this.
Fabio, you want to speak for a few minutes about it?
Yes. Hi, everyone.
Go for it.
Yes. Okay. You hear me?
Yes.
Okay. So this is a product that I'm working on for an company, and this is basically
just listening.
Sorry. Hello.
The onion, Jay. I thought they were that chicken corn.
No.
Did you hear me?
I think somebody's talking that's.
Yeah, it sounds like somebody else is talking.
Hello.
Is Jay unmuted now, or?
Hello.
Okay, go ahead, Fabio. Yeah.
Fabio.
I don't know if it works or not. So this is a booking reservation project. So it is a Claris Connect and a couple of services like Calendly for the reservation process, and we also use FormStack to allow the visitors to register in the system. So the facility knows the visitors. It releases a code, a personal code that it allows the visitors to book a reservation for the facilities, and everything is managed by Claris Connect. And the backend is obviously made by made using FileMaker, and we also using WebDirect for the client, and that's it.
Do you want to talk a little bit about the use case, like what they need it for?
The use case is basically this project is used for the home care and healthcare facilities, and because the COVID, the visitors has been to register and has been to known in the system. If you want to like visit your parents that are hospitalized in these houses, you have to pre-book your visit using this system, and to do that you have to have a personal code that identify you in the system, and that's it.
Yeah. And this one has the potential, like they're sort of piloting it at a few facilities now. And I know this is in Belgium that we got this project from a developer there named you. And they're piloting it at a few facilities with the hope that maybe eventually this could be used by the entire facility system across the whole country. And yeah, so it has a potential to really help out. There's also going to be, I think, a sort of a handheld iPhone or handheld sort of a check-in process. So like if you are going to go visit your Uncle Rupert at a facility and you sign up for one of these slots and then you show up at the facility, that there's going to be like a visitor coordinator or a gatekeeper at the door who's going to meet you and sort of like boop, take your temperature and make sure you don't have a fever and make sure that you're wearing the proper PPE, and then kind of like log you in on a handheld part of the system. So this is really going to be using a lot, like all the tools, right? There's a FileMaker, there's Claris Connect, there's integrations, there's maybe some custom web front end. I just want to take a minute to thank Beeswax for this, because this is another one where I was like, wow, this is a really big, medium, complicated thing. And I reached out to Jay and said, hey, do you guys have bandwidth for this? It needs all these different things. And he was like, yes, of course. And then the next thing I knew, he was emailing the whole team, and then it was all this email going back, and you guys whipped this up in what seemed like a couple of days. And I don't even know how you did that, but it's pretty amazing. And so thank you for building this amazing thing. And I think this is also another one of those that once it's done could be leveraged in, how many senior living facilities are there in the world? Thousands and thousands and thousands. So anyway.
You guys definitely won Chris over. We were getting text. We were getting text. Like
I didn't have any doubts. It wasn't that I had doubts. Don't say that. But I was just like blown away by this.
Yeah. He was saying like Beeswax is killing it. They're working over the weekend and they're already done. And I think somebody sent a little video and Chris forwarded it to us and we were all like, whoa. Like it's really, really cool what you guys did.
Yeah.
It was a really good
simple, but so useful.
Yeah.
All right. Are there any more? Is this the last one?
Okay, so we have, I don't know if this is the last one, but this is the Developer App Academy. So this one's kind of cool. So for those of you who know about the Developer App Academy or 42U, there are students who go through the FileMaker training program. And these students got together and decided, while we're sitting around, let's build, use our FileMaker skills to do something for good. So they put together a proposal for putting together a FileMaker app, which they already started, and it was for helping nurses like track everything they need for home care. So when a nurse goes to someone's house, they basically have a checklist of things that they need to bring, and and depending on what the request is for. So they wanted a actually Marangella, right here in the middle, her mother is a nurse. So that's what kind of inspired this. She was watching her mother. She's a nurse manager, so her mother manages all the other nurses, and watching her use spreadsheets to manage what each nurse needs to bring for their schedule, and Marangela's like, why are you doing it this way? There's so many better ways to do this. And so she built this team and created an app. And they asked, they asked Join Table to just give them a technical lead to help guide them when they're stuck. So that's what we did. We assigned somebody to help them. And this one I think kicked off, was it last week?
A couple of weeks ago, yeah.
yeah.
But
Yeah.
that's what's great about having developers from all over the world, because these 4 folks spoke English, but it was obviously not their first language. They're in the Naples area, one of the hotspots. But we did happen to find a partner who's there, Giuseppe Francica, and he was the volunteer to.
Yes.
I hope I said that right. To kind of be that splinter to these 4 Ninja Turtles. To get them, I mean, they actually already, I think, were smart enough to hack together a database, but to kind of like get the moving parts, and this is maybe going to be distributed over LTE on devices while they're walking around town and doing their appointments, and writing up prescriptions and checking their inventory and all that kind of stuff. So there's some a little bit of that ins and outs of that distributed app, maybe web direct sort of stuff that they wanted some help with, and so he's been a good resource there.
Okay.
Is there more? Oh yeah, actual food. I think this is the last one.
I think that's the last one. Yep, that's the last one. Okay.
So this is one that's based in actually I don't know where Greg is based.
I want to say
Connecticut.
Okay, that's not what I was gonna say, but yep.
Juliet, were you gonna speak?
I don't need to speak about this when you know about it.
Foods. Okay, so this is I forget where he is. I think he's on the East Coast, but it's basically an app that's going to be managing like a web-based app where a bunch of scholars can manage academic papers and research in sort of an online repository, where it's all back-end managed with FileMaker, including all of the documents, the PDFs, and all of the ancillary materials, maybe even like audio recordings and other things related to research, slide decks, Excel spreadsheets, data sets, and whatever. All related to COVID-19 related research. So the front end is intended to be a, sort of like a read-only sort of general public facing sort of mostly of interest to academics, list and search where you can look up and read this research. And then also a separate sort of login based web direct system for a lot of the scholars that are vetted into the system to actually populate it and read and review the material and upload the material. And then, as you can see here, sort of there's a few admin sort of master editor folks on the back end that are managing the database from that side, and sort of like when things get ready, checking boxes and allowing those to be found on the website and so forth. So this was just a very initial sort of mock-up of the back end system. And this is being built by David Sullivan in the Chicago area. You may know him as Sully. And then there's a few other people that just came on. Laura is going to do some documentation for it, and Andrew Simpson, I think, is another developer who's going to help with some of the web direct stuff. There's a lot of like really complicated. We didn't have a slide for it, but like the workflow for getting all this material through vetting and second reading and second editing and all that kind of stuff is very kind of a loopy, iterative, complicated workflow on the back end. On the front end, it's going to end up being very simple, but there was just a lot of work here. So this is a combination of at least 2 developers and 1 documenter to get this going.
We actually had a kickoff call like 2 hours ago because we added 2 new people to the team. We added Andrew Simpson to take care of the data API stuff because Sully built the FileMaker part, but now the FileMaker part needs to actually be posted on the website. So he's going to take care of the data API stuff. And then we added Mary Pitson from Sliant. She'll be taking care of the web direct stuff. So the web direct side is going to be where the doctors can actually go. They have an account and they can find any articles and then submit it here to the database for review. So the idea is anything that is scientifically proven to be effective in fighting COVID through foods, so through health, diet. So that's kind of what they want to try to gather and publish on their site.
I think that was the last slide, right?
Yeah, that was it. So I guess we'll open for questions. I'll stop sharing my screen.
Remember that you're on mute if you want to ask a question.
Let's see. So my first question is like, what kind of experience, skills, and tools prepared the CCRT members to contribute? And I noticed that the Apple Developer Academy were like just starting out at almost ground zero, right?
Right.
I would say there's a little bit of everybody. And that's kind of the great part of it. Is so when we on the intake form, we actually ask, how many years of experience and how would you rate your level of experience, sort of beginner, intermediate, advanced, or whatever. And so when they submit that, then on the back end, we're able to kind of piece together a team. Some people don't want to be the lead developer. Some people don't either want to, or they don't have the experience, or they want to learn from somebody else, or they think that they don't have the exact skills for this part, but they want to be part of the team or whatever. So I would say it's all across the board. There's very beginners. There's obviously people like the people on the beeswax team that have been around the block for many years, and kind of everybody in between, with all different industry skills and FileMaker skills and Claris Connect skills and interests, all across the board. Does that kind of answer the question?
Absolutely.
Yeah.
Another question I had was along the way, did you guys discover anything that really just wasn't working and you had to make like large changes, or do things in a different way?
I'm trying to think.
One thing I would say is when we posted on the blog some of the kind of examples, but we actually didn't have a copy of them yet. And sometimes, and people say like, oh, this would really help me, but we didn't have a copy. And sometimes it takes longer to get a copy than you would think, or they just weren't done, and some things take longer than you think. So one thing we did learn was like, okay, we're only going to post things on the blog that are done, and we have a copy and they're documented. But that's the only real thing I can think of. Everything else has gone pretty smoothly. I mean, we have had a couple developers who'd say, we reached out to them and they said, oh, I don't have time to commit to this, but that's normal. Obviously, this is a crazy time and people's schedules fluctuate, and so we just move on to the next pick. But yeah, besides that, that's really it. Everything has been usually pretty smooth.
Yeah, I think the only other thing I would add to that is there have been a couple of occasions where some requests have come in and they haven't met the criteria, and it's really hard to gently say that doesn't meet the criteria and try to stay very true to what our mission is. And that's been a challenge because hard. Those are hard decisions, really hard.
Yeah, great. And sometimes, like at least through Join Table right now, we're just focusing on COVID-related apps. So we've gotten a couple non-COVID related apps, and so we had to say yes, but later. Like we can't help you right now. We're really swamped, so that's been hard too. And some of our current projects we had to put on hold because we were just focusing on COVID related because of the urgency of it.
Are you saying that they were probably good projects, it's just they weren't top priority at this time?
For the Join Table ones, yeah, like they were just nonprofits that were asking for something that had nothing related to COVID. So yeah, exactly. They would have been projects that we would have accepted, and we're probably still going to accept them, just not right now. Like we have to kind of put that stuff on hold. Any other questions?
Oh, I got a few more. Nobody else does. Along the way, did you learn anything about this pandemic, COVID-19, or how things work? Were there big eye openers as to like, what people go through when they're, hit with an emergency like this?
I feel like it's the answer is kind of what you would, or at least what you always hope is true, but then when you experience it, you're glad that it is that everybody just like immediately wants to like open up and help, right? Like I've got an app, I've got spare time, I've got, what time zone is it by you? I mean, I'll get up early or I'll stay up late. Like all of us on the team, like we're in, Murray's in the UK, and we've had people on the West Coast, and join tables in 3 different time zones and that kind of stuff. So like people are just blowing us away with, like I've got this, I can handle this, I'll help, I'll lead this discussion, like there's I think actual food meeting going on right now with these people that we can just kind of set them loose and go with it, even if there's language barriers sometimes, or like somebody that doesn't speak super good English, but they're like, I'm gonna push through and we'll make this work. And so just seeing all of these teams come together, it's just kind of warms your heart. Like I keep saying to the whole team, like when we finally can, engage in person again, we need to have like a 15-minute group hug or something. Maybe not that long. That's a little, uncomfortable, but like some kind of like it just, we're changing ourselves and we're changing each other and we're changing the world. It sounds a little corny, but I think it's true. So that has been pretty.
It answers my next question is like, what were the lasting effects of your efforts that you're seeing or you're expecting from all this?
I mean, like the repository for sure, right? Like we're coming up with a whole bunch of apps, which at the end of the day, like I don't know if these go in the Claris marketplace or if it's its own COVID marketplace. We haven't really talked about that in detail, but like we're coming up with all of these tools that we can just say, like pandemic or otherwise, there's still going to be medical facilities. There's still going to be old people living in care homes, right? Like there's going to be the need for all of this stuff, and we're building it all now. Well, not all of it, but we're building a bunch of stuff that can go out there and then just be out there, and then people can take it, and some of it will be open source, and they can just run with it and make it their own. So I think that's going to be one lasting legacy. And then, like I said before, like just all the connections that all these people are making. These are like lifelong connections. These are the kinds of connections that when you make them in times of strife and stress, that they just stick with you. At least for me.
I think for me, it's been amazing to watch how the developer community just jumps in and works together. I mean, in many cases, these teams, you could argue, are competitors. We are totally unique. I don't know any other platform that we could just do this and developers would just say, yeah, I'm gonna work with that guy. It doesn't matter that he might be my competitor in every other way in the business or has been for years. That's all set aside. And these teams are just coming together for the common good. The same thing with the code and the apps that are being brought forth. I know from many of the developers that have brought those forward, those are hundreds and hundreds of hours of work that they have put into those tools, and they're just saying, here, use them wherever you can use them. It's amazing.
I'll also add that what have we experienced through this that was like personal is everyone has their own like COVID experiences, and we're hearing from all of our volunteers some stories and things. And so one of our volunteers, like her father passed away from COVID, so that was like really hard. And then we've had people talk about that they lost all of their contracts, or they have 0 active contracts right now. So it's hard to like kind of hear the difficult side of these people that we know and what they're going through. And another thing that, as far as lasting effects, I'm really thankful that Julie and Brad thought of a join table, because this has been so great for getting the word out of what join table is. And so I'm hoping a lasting effect will be that, we'll get more nonprofits and people who signed up for volunteer for COVID related apps, they'll still be willing to volunteer for other projects once COVID is over. So I'm hoping that that's a lasting effect, that join table, our mission and who we are, like our name will kind of get out there, and our join table team will just grow over time because of Claris's help for get like kind of introducing us through the Claris COVID Response Team.
We're just feeling so many warm fuzzies that we want everyone to feel the same warm fuzzies that we feel. That's all we're saying here.
And then I guess you already answered this one, but you're still taking volunteers for. I mean, there's still things that need to be done for this response team here. And
I mean, both, right? Volunteers, and if you guys know of any, apps or areas with your existing clients or just people in the, in the neighborhood, in your communities or whatever that, I mean, FileMaker and Claris products, right? Like, what would be a good fit or what's missing, or you'll hear from people that you know. So if you hear of any of that kind of stuff too, obviously, whether it was that slide earlier to just go to jointable.org and fill out one of the forms there on the contact page, so that'll just triage it right into our database, and you'll hear from us right away. We're pretty good response time.
on the intro video that you guys Claris had on this whole topic, I saw a quick clip and it had Louis de la Parra on it, right?
Yeah, that picture that you sent. So that was from the Sense Nexus kickoff call.
Oh.
That's what that was. So we were talking about the best technologies to use for the and that's the conversation we had about do we use the Apple Watch? And we actually decided the Apple Watch was not the best fit because we needed something that I'm going to totally use the wrong word, but it basically sends data only. It doesn't receive data. So that's the kind of device it needed, because if it's constantly sending, it just kills the battery on the Apple Watch. So so we needed something that was send only, and so that other device in the screenshot was the device they ended up going with. But that was a very technical discussion. What devices do we use? What's capable for receiving data?
We've pulled meetings with Giuliano, with Sangeeta, with Rick Kalman, with our SE team. I mean, the minute we need to solve a problem, that we're calling. So nobody is immune from receiving a call from CCRT within the halls of Claris by any means.
Well, am I the only one asking questions? Let's see. Can I cover it?
Any other questions we can answer?
And then the other thing, if we're all done with this presentation, still, if there's other people who have anything relevant to the topic at hand, like other things that they're doing in-house or anything like that, please feel free to share. I know that over San Jose State, one of the things we've had to do is turn a lot of things into electronic. We print a lot of letters for admissions, and we've turned a lot of things into PDFs really quickly, and it's been pretty convenient, actually.
So Daniel, you send a chat note here that says, if we know of an organization that needs any one of the apps in the repository, what's the best way to connect them with you? So you can just email Julie, or you can email jointableteam@gmail. Doesn't matter, either one of those, and it'll get through. And we'll set up a meeting and say, hey, what do you need? What's your need? What app would be a good fit? And just take it from there.
What's interesting too is sometimes we've had requests saying, oh, I need this app. We actually go talk to them and we're like, no, you don't need that app. You need this app. So it takes a meeting to kind of talk through their needs and before we decide really what is the best fit.
Right. Or we can take this from the repository, but we need to add this. We'll get you a developer from the volunteer database and switch those together to get you the app you need based on a good starting point.
So if they go to the website, can they reach you from there?
Yep.
Contact.
Yep. jointable.org/contact. There's a form there, and then there's a couple links for specific forms if you're a nonprofit or want to be a volunteer. Also, go look at the Claris blog, right? The Claris blog has a couple of entries that list all of these apps, what they are, what their names are, and then how to reach us from there as well. I didn't mean to cut you off, Julie, sorry.
Right, you read my mind. You read my mind. You finished my sentences, Chris.
I know. Anything else?
What did you guys think about the example projects? Were they what you were thinking we would make, or if not, would you would have thought?
Have we exceeded your expectations? That's what we're hoping.
Well, the dentistry was a surprise to me.
Why was it a surprise? Just because that it
Oh,
exists?
Well, you just you just think of medical related
Right.
thing. Well, of course,
Right.
dentistry is medical, a type of
Right.
medicine, but it's like you just don't think of those sort of things when you're just kind of
Yeah, but yeah,
in the
that's a good
news or
point.
whatever.
Right. You don't think necessarily about the things that cannot happen because of, the lockdown and everything, quarantines. Cool. Well, thanks for
Yeah.
having us.
Yeah, thanks for coming. That was
Thank
that was
you.
great. Yeah, I mean, I kind of saw it late too. I mean, I had been to the community for a little while, and then I went over there to go look up something or ask a question, and then I saw this big banner that pointed me to all the stuff that was going on. I said, "Oh, wow, we should find out more about this." So it was great.
Hi, this is Vaughn. Am I unmuted now?
Yes.
Well, I just want, probably what is gone unsaid by all of us that have muted through the whole thing is a big thank you to everybody here, to the people that put this together, all the work that you're doing. And kind of a corollary to that, it might be helpful if there was a way to do it, and maybe you're already doing it. How many installations of this are there? I know it's new, so it's probably in its very young stages and it will grow. But I think that would be helpful for people to see, to kind of answer your questions in real time. These are the apps that are being used. These are the ones that are proving to be most popular. And maybe these are the areas where we can focus more. Or there's one other thing, and that is that when you were talking about the dentist, you were talking about the dental association. And aside from this, not FileMaker related, but COVID related, we're dentist, and when we're get ready to present the product to them, we intend to do it through the dental associations. And as I saw this, I said, hey, you know what? If we're going to be working with these dentists, these associations anyway, we should probably turn them on to that program. So that's a takeaway for me.
Yes.
Awesome.
Yeah, it's interesting. Another need that we've had is the translations, right? Because that's all in French, and we've had some apps in other languages. So in order for us to kind of take them and be able to really distribute them, we've had to ask for translators as well.
So Vaughn, were you asking is there like a comprehensive list of all the apps that have been developed or being developed for?
I'm just saying that almost from a marketing perspective, even though we're not directly marketing this for profit, just the idea of tracking, you may not be able to do it easily, but tracking the number of downloads perhaps, or the number of people that are using it. And even almost along, I know this is another step, but just like you've got the map there that shows where your volunteers are. Okay, let's take the dentist app. Okay, let's take the dentist app, and let's say that down the road, 3 months from now, 6 months from now, there is another map that shows the different states or the different cities, throughout the world where this app has been downloaded and is in use, or at least downloaded or been in interest is used. Because then that does a couple of things. It first of all, it shows the dentist, hey, this is something that actually is useful in my industry. Because look, there's people all over the world that are using this. Two, it gives them a point of contact. They can say, okay, well, I'm in Canada and I see that there's somebody here in this province that's using it. And yes, I can talk to him in French and I can check with him. In fact, I guess it's just, it's kind of a marketing perspective and just trying to spread the word. Obviously, you have to have the programs first that you've built, but this is kind of, I guess, the next layer is spreading the word about it. because anytime we spread the word about FileMaker programs, if people use FileMaker programs, they're by default using FileMaker.
That's great. No, but I like your ideas. Those are some things for us to certainly think about. Do drive, anyone that is interested, which we've done 3 blog posts on claris.com/blog about the CCRT. We've done that since its inception at the end of March. We're going to continue to do that. We do have an update. One of those includes a video. We have an updated video coming out soon. We're trying to be as communicative about it while, again, building the plane while flying it.
Yeah.
So I totally get your sentiment, and we're trying to get the word out as much as possible. That's one of the reasons why we started trying to list the apps as they were coming online, to try to paint that picture for somebody in need, because we know an end user, unlike most of all of you on the call, an end user is going to say, I got a problem. And if they happen to trip across something that we wrote in a blog that's like, oh yeah, I've got something like that, we were hoping that would trigger a call and another way for them to go, I think you guys have a tool that can help me. Here's my problem. So that's all we're trying to do as quickly as possible in the midst of this.
I mean, I think I would say from the join table side, eventually, like you said, we're kind of running to try to just stay ahead of, keep our heads above water, doing it right now, and later we can talk about it. I think we would probably love to sort of feature on our own little humble blog page, like some of these amazing stories that we've been talking about, these developers meeting and who didn't know each other, who whipped up stuff and built connections for life and all that kind of stuff, sort of around Claris products, yes, but mostly about, wow, like this is what me and Maka and Nick and Jonathan set out to build from the beginning, and like not only did it happen, but it happened 10,000 times as big as we thought it would be, impact wise. So anyway,
I think I'd be remiss if I didn't acknowledge on behalf of Claris how appreciative we are for Join Table, the volunteers, and Julie, who is beyond a volunteer in this case. It's such a great effort, and when I spend time with the community, I'm constantly reminded of community strength and the connectedness between everybody, and I think even for those who aren't participating actively as volunteers for whatever reason that aren't able to, I think this is providing a lot of strength. I know lots of people are kind of cheering for this team from afar, all around the world. So it's a great effort, and I can't thank you enough for it. So huge appreciation.
thank you.
Really a great idea.
All right.
Right.
Thanks again. I think we're gonna go ahead and, I mean, we can go as long as 7:30, but yeah, might as well. I think we're good.
All right. It's late on the East Coast.
Yeah.
Nice to see everybody.
All right.
Stay safe,
Thanks,
everybody.
Thanks for having us.
Thank you.
Bye.
Thank you.
Thank
Bye.
you. Bye.